Hi, rapid antigen tests for the diagnosis of COVID-19 have become commonplace, are relatively inexpensive, and in some cases may be obtained free of charge. Let's take a closer look at what role these tests can play in the management of COVID-19. The best way to curb the spread of the SARS-CoV-2 virus is by widespread testing, contact tracing, isolation of those who test positive, coupled with personal protective measures such as hand washing, mask wearing, social distancing, and vaccination. Testing for COVID-19 can be performed by detecting the SARS-CoV-2 virus genetic material, that is, its RNA, or by testing for proteins of the virus known as antigens, or by testing to see if the body has mounted an immune response to the virus by producing antibodies. Up until now, the most commonly used test to diagnose COVID-19 is the reverse transcriptase polymerase chain reaction, which is a nucleic acid amplification test that detects the presence of the viral gene or RNA. However, RT-PCR reverse transcriptase polymerase chain reaction testing requires expensive equipment, highly trained personnel, scarce reagents, and most of them require a long time before results become available, although there are some rapid molecular tests that can give results within minutes. Rapid antigen tests offer a quick and easy way to screen for COVID-19, both in point-of-care settings such as doctors' offices and clinics, as well as at home. These tests can detect active infection via a nasal swab in under 15 minutes, even in asymptomatic people. Widespread testing for SARS-CoV-2 virus requires a widely available, inexpensive, accurate, and simple-to-use test. And at this point, rapid antigen tests appear to be most suitable. Unlike the nucleic acid amplification tests, which depend upon the detection of the viral RNA, antigen detection is based upon the identification of viral proteins known as antigens. The two main antigens in antigen detection assays for SARS-CoV-2 virus are the S or the spike protein antigen and the N or the nucleocapsid protein antigen. Currently, the majority of rapid antigen tests use lateral flow immunoassay technology. A typical lateral flow test consists of overlapping membranes mounted on a backing. The sample containing the antigen of interest, in this case the SARS-CoV-2 antigen, is applied to the sample pad, an absorbent pad that allows the sample to migrate into the conjugate pad, which contains antibodies that are bound to colored particles. These antibodies are specific to the antigen, in this case the SARS-CoV-2 antigen, and react or bind to the antigen and continue to migrate along the test strip into the detection zone, which contains a line of fixed antibodies on the surface of the membrane that reacts with the conjugate antibody antigen complex, fixating them and causing this line to change color because of these colored particles attached to the antibodies in the antibody antigen complex. A control line that just reacts to show that fluid has been detected at this end of the strip is included, and at the end of the strip is an absorbent pad, a wick that collects any excess sample that has migrated through the strip. Lateral flow assay tests are very good candidates for widespread testing because they're cheap to produce, easy to use, and most importantly, they're widely accepted by users and health regulators. Moreover, because of their long shelf lives and the fact that refrigeration is not necessary for storage, they're very well suited for use in developing countries, small ambulatory care settings, and remote regions. Lateral flow diagnostic tests are often less sensitive than molecular methods, but can detect the SARS-CoV-2 antigen reliably when the viral load is high, typically 1 to 3 days before the onset of symptoms through 5 to 7 days after the symptoms begin. But by the second week after the appearance of symptoms, the ability to detect the SARS-CoV-2 virus decreases. The most important indicators of the accuracy of rapid antigen tests are their sensitivity and specificity. Sensitivity, or the true positive rate, refers to the proportion of people who have COVID-19 who are diagnosed by the test. Specificity, or the true negative rate, refers to the proportion of people who do not have COVID-19 who receive a negative test result. The World Health Organization accepts a sensitivity of greater than or equal to 80% and a specificity of greater than or equal to 97%. A negative rapid antigen test does not rule out infection, so that if COVID-19 is still suspected based on the exposure history and symptoms, retesting or testing with a nucleic acid amplification test should be considered. The CDC recommends that people who come into contact with someone with COVID-19 should test at least 5 days after the exposure. With the Omicron variant, it may be necessary to test 2 to 3 days after the exposure and every other day through to day 6. Because of changes in the proteins of the Omicron variant virus, some of the tests may be less sensitive to it. The type of testing and documentation required for international and air travel may vary by airline, travel destination, and state requirements. You should therefore contact your airline carrier, visit the CDC TSA website, or your local health department website for recommendations on acceptable testing and documentation requirements for your travel destination. If you're taking a test prior to visiting someone who may be vulnerable, the best time to test is immediately before the visit. Testing the day before may miss infections that only show up on the actual day of the visit. If you recently attended a crowded indoor event, traveled, or received notification of exposure, experts recommend that you should test 2 to 3 days after the exposure or the event. And if your test is negative, you should test again, ideally the next day or every other day through to day 6. All persons, regardless of their vaccination status, who receive a positive test result from a rapid antigen test should isolate themselves at home for a total of 5 days from the onset of symptoms, or for 5 days from the test date if they're asymptomatic. Rapid antigen tests are currently authorized to be performed on nasopharyngeal swabs, nasal swabs, in people of all ages, at point-of-care settings in the laboratory or at home. A list of all the tests that have received emergency use authorization, as well as their sensitivities and specificities, can be found on the FDA website under In Vitro Diagnostics EUAs. A link can be found in the description below. If you found this video useful, like and share the video, and support this channel by subscribing. Until we meet again, thank you for watching.